Good evening. I'm Tim Gibbs with Delaware Health Force, and delighted to be concluding our series with Nemours, which has been focused on children's health and pediatric medicine. And YouTube streaming is at youtube.com/Delamid302. If you need to talk to anyone about making up a class or you have questions, please email Nicole Sabine. Nicole is not with us this evening, but there's her email address. National Public Health Week is fast approaching. You should have gotten information about National Public Health Week contest that we've got going on. And we sure do hope that you will participate, and I'll make sure that that's gets sent out again to everyone this week. Housekeeping tips. Remember that this is a Zoom webinar. We don't see you, but you see us. You can't see each other. This isn't a Zoom meeting. Please use the Q&A feature. We don't use the raised hand feature. Remember, don't ask questions of a personal or a family nature. At the Q&A part, which is at the end. We will do our best to answer all questions. Christy and I will handle any of the housekeeping questions, and we will defer the clinical questions to this evening's presenter. You do need to stay through the entire presentation, but once the Q&A at the end of the presentation starts, you can then leave and you will be counted here for the class. So we've been on quite a journey with our colleagues from Nemours. We've talked about respiratory therapy, emergency medicine physician, what it's like being a pediatric ER physician, being a pediatric intensive care physician. We heard from a number of different types of advanced practice providers. Remember, those are physical therapists and nurse practitioners. And this evening, we're going to hear from Julie Fausnaugh, and I will turn it over to my colleague, Christy Hanley, to introduce Julie.
Good evening, everyone, and welcome. And thank you, Julie, for joining us this evening. A little bit about Julie. It's Julie Fausnaugh. She is a 4 West nurse manager at Nemours Children's Health. She began her career 26 years ago and has proudly served in the roles of clinical nurse, assistant nurse manager, and has been in the nurse manager role for the last 5 years. She's worked on the inpatient nursing units, the PICU, the IV team, and was part of the nursing supervision team in the past. She graduated from Del Tech and Community College with her ADN in 1998, Wilmington University with her BSN in 2000, and her MSN in 2023. She is a certified pediatric nurse, and throughout her career in pediatric nursing, Julie has always been very involved in incorporating initiatives to improve family-centered care. She has been instrumental in starting the virtual nurse program on 4 West at Nemours Children's Health in Delaware, and has since helped to continue the program to other inpatient nursing units within Nemours. Throughout her tenure, she has worked to use innovative strategies to improve processes that impact patient outcomes, flow, and the overall patient experience. We welcome you, Julie, and we're going to turn it over to you.
Thanks, Christy. Thanks, Tim. Welcome, everybody. So I'm going to start off today and kind of tell you my nursing story. And then I have a PowerPoint to kind of give you some information about nursing in general. So I was somebody who really never was positive what they wanted to do when they grow up. Around the age of 12, I started having symptoms of asthma, and really as a child was hospitalized a lot for respiratory illnesses and asthma exacerbations. And really throughout that time, when you're admitted to an inpatient, unit, you really become very familiar with the staff. I had staff that, took care of me over and over when I was admitted. And really, it really sparked my interest about, maybe wanting to do something in medicine. So initially, I thought I wanted to be a respiratory therapist. And I know you heard from some of my colleagues at Nemours who are respiratory therapists and learn more about that profession. But as I started to get closer to high school graduation and, exploring college options, I thought, what, maybe nursing would be better. Like, I think it would allow me to widen my scope, and I would be able to, do more holistic care of, a patient instead of just focusing on respiratory support. So I started looking at colleges. I ended up going away after high school to a 4-year college that I thought was going to be the perfect fit for me. Got there and I learned very quickly that it was not. And so really after the first semester around Christmas time, I came home and I said to my parents, you know what, I think this isn't going to work for me. I don't think I'm going to go back. And my dad said to me, oh, you are going back. If you don't want to go back there, then we're going to find you somewhere else. So really at that time, nursing spots were actually very hard to come by. And I really started exploring other programs and what I could do. And I was really somebody that I knew I would do better if I was in a small environment where I really could get to know my teachers and they would know me. I knew based on what I had learned from the first school that I went to that I wanted to do clinical out the gate. I didn't want to wait until my junior or senior year of nursing school to be able to start interacting with patients and their families. So really when I started looking at programs, honestly, Deltec's program was very enticing to me. It was small. There were only probably 40 people at that point in one class. They were very welcoming when I toured there and I just felt like, okay, this is a good fit for me. So at that point you had to take a test to get a clinical spot. They took all of my prerequisites that I had already taken from, when I was at the other school. And so I really was able to start pretty quickly in January when spring semester started and I went back. It was a great fit for me and it really afforded me tons of opportunities that I really don't know that I would have considered had I not, started out somewhere else and really pivoted. So that's kind of where I landed. And when I graduated from nursing school in 1998, there wasn't a whole we didn't have like the nursing shortage that we had now. So for people who wanted to work in a hospital, those jobs were few and far between. It was very much a time when it was go to the nursing home or go do something to get your experience and then come back when you have some experience and then we'll consider you for a hospital position. And I just knew that I wanted to be in the hospital. I had had great clinical experiences through Deltec, and I knew that that was the environment that I wanted to work in. And I was pretty determined that that's where I wanted to land. So I put a bunch of feelers out after graduation. Nemours offered me a casual position as a brand new grad. What that means is that, I would be afforded hours based on what the unit needed. So that was a little scary as a new grad, but I was still living at home with my parents. So, at that point, I didn't have tons of bills or rent or things like that I had to pay. So I thought, okay, I'm going to take a chance on this because this organization seems like it will really be a good fit for me. So I accepted the position. At that point, I was a floater. So I worked on a floor that was very much a chronic floor. So we took care of patients that had a lot of chronic conditions. So we had children that had cystic fibrosis. We had kids that had complex GI issues, complex surgical issues, things like that. So it was a great place to get tons of experience on this floor. And if there was ever a point where that floor didn't need me, then I worked in the ICU. So they cross-trained me to the ICU so that I could float between the two units, as needed. So really working in the PICU gave me a wealth of experience of taking care of really critically ill children while still getting the experience that I was hoping to gain across the organization. I keep floating in and out of a different thing, so I apologize for pausing. So really, I spent probably the first 15 to 18 years of my career pretty much at the bedside. I was in charge nurse roles. I was an assistant nurse manager at one point, but really that was very enticing to me. And I was okay with that because I love taking care of patients. And at that point, I was starting to have a family of my own. And one of the things I will say about nursing is it does really afford you the flexibility to work many different shifts or, be really very flexible so that you can be a mom and you can still be a nurse and have a career. So I did crazy shifts when my kids were little, like 2 a.m. or 2 p.m. to 2 a.m. I did 3 to 11. I did 7 p. to 7 a. Really so that I could be home with my kids and not need to send them to daycare, which was very enticing to me. So my husband and I kind of worked opposite of each other, but that really worked for us. And really, I did that until probably about 15 years ago. And 15 years ago, I was, asked to take on more of a management role. I, went back into an assistant nurse manager job at that point, and took on more, administrative responsibility. So I did things like the schedule and, education for staff and things like that. And that really worked out well for me. And then an opportunity came up for a nurse manager position. And, everybody told me, I think you're really ready. Like this would be a great, growth opportunity for you. And so I took the plunge and I was offered the job, and it was for 4 West, which is a short stay unit. So we're really kind of a unit that's an extension of the emergency room. So the children that come to us are really kids that are not really medically complex, but they're really not ready to be quite discharged from the emergency room yet. So most of the children that we take care of don't have a complex medical history, but they might be admitted for asthma, or bronchiolitis is a disease process that you get from a lot of times like the common cold. But children have very small airways. So what we see is that a lot of the things that children are admitted for in the pediatric population is respiratory in nature because their airways are so small. And I really want you all to take a look at your hand and look at the size of your pinky. So that's how big an airway is. That's how big your airway is. Now imagine if you've ever like babysat or have a younger brother or sister or a cousin or something like that, and think about how tiny their hands are, or a newborn baby, how tiny their hands are. That's how small their airways are too. So when we think about that, we know that when you're super congested and you have all that mucus in your airway, it's oftentimes very hard for you to breathe. Think about like if you have a stuffy nose and you don't blow it, how hard it is to breathe through that. So a lot of the things that we see children admitted for, healthy children typically, are respiratory in nature. So the floor that I manage, we do really focus a lot on respiratory diseases. So things like asthma and bronchiolitis, like I said, but it really is more geared toward the healthy child who's really just having a bump in the road and needs some support, and maybe the family needs some education to be successful taking care of that child at home. So that is actually very rewarding to me because, I think as a nurse, you have the ability to make a huge impact really every day. There's no 2 days that are ever alike. There's no 2 kids with asthma that are ever alike. And I think that you're able to meet families where they are and really help them with whatever help they need in order to be successful moving forward. And, the goal is always to have them take their child home as healthy as they can. We do a ton of education, right? So most of our kids, some of them have never been admitted for something like this before, right? So there's a ton of education that needs to happen for a parent to be able to successfully take this child home with them and be able to care for them so that they can get better. If anybody has ever had an asthma attack or things like that, we do like asthma action plans, and we'll say, this is what you're going to do if you're within this range, or this is what you're going to do in that range, or this is what you're going to do if you're in the worst range, and it's probably coming back to the hospital. So we do lots of education so families can be successful with their children at home. So my current job right now is to do everything operationally to manage a nursing unit. So I'm in charge of hiring staff. I'm in charge of making sure they have the right education. I'm in charge of making sure the schedule and the skill set for the schedule is correct every day so that no matter what, we can care for any patient that is admitted to our unit. I do have an assistant nurse manager who helps me. Her name is Jen. She's fabulous. We've actually been very close for a long time. We really both started our careers at Nemours and have stayed. So I'm coming up on 27 years this June, and I think Jen's been there probably 24 or 25. So we really, work well together. I feel like we can kind of finish each other's sentences because we have worked so well together. But she's kind of my right-hand person for all things operational on the unit. What else can I tell you? So my husband and I are both long-term Delaware residents. We've both never lived anywhere else. We went to Delaware high schools and, grew up throughout the state. We do currently have 3 daughters, and my oldest daughter is currently in nursing school at the University of Delaware. So she's going to be a senior at the end of the spring. And so I'm really excited about that. It's fun that we're to the point now where we can kind of talk nursing stuff and we both understand each other. And, it's actually very fulfilling. So I am going to switch over to a PowerPoint and tell you a little bit about nursing in general and, kind of what it takes to be a nurse. And just bear with me one second while I start sharing everything.
We can see it.
Is it in?
Just use the arrows at the bottom left-hand corner to go back to the beginning. Start from beginning. Yeah,
There.
you can do. There you go.
Thank you very much. All right, so we are going to talk about who wants to be a registered nurse. So if you look up in the dictionary, the definition of nursing, a registered nurse, or, we typically call each other RNs for short, is a nurse who holds a nursing diploma or an associate degree in nursing and has passed the NCLEX RN exam administered by the National Council State Board of Nursing and has met all the other licensing requirements mandated by the state's Board of Nursing. So the one thing that's really unique about nursing is, no matter where you go to school, if you go to Del Tech or you go to Harvard, everybody takes the same test. So what happens is when you finish college, it could be, there's really not diploma programs anymore. So really everything is either an associate's program or a bachelor's. And an associate's program is something like Del Tech. A bachelor's program is something that is a 4-year university. So typically, if we're looking at the state of Delaware, that would be like University of Delaware or Del State are really the 2 in Delaware that have BSN programs. So it is really unique because no matter what route you decide to go, if you do an associate's program or a bachelor's, everybody takes the exact same test. There are requirements. So once you finish the program, wherever you went to school, the school has to submit your transcript, and then the Board of Nursing will give you eligibility to test. And you go into a testing center and you do take the board's computerized. So it's a test that you sit down and take computerized, probably very similar to like the standardized testing that you guys take every year for school. And you finish the test and then you actually do find out right away now if you passed. It didn't used to be that way when I took boards, but it is that way currently, and it has been that way for probably about at least 15 years. All right, so when we think about nursing is really a combination of science, care, and communication. So when we think about science, we think about things like anatomy, right? Anatomy is like the makeup of your body. Anatomy and physiology is all about your body and how it works. So when you think about nursing programs, there is a very strong concentration in science classes. So it's not uncommon for a prerequisite for a nursing program to be, or embedded in this, is lots of science. So things like A and P, you usually take anatomy and physiology 1 and then anatomy and physiology 2. And within those classes, there are, labs where you're learning how to dissect things and how to identify muscles versus bones and tendons and things like that. And then the physiology part of it is really, how does that work? Or, why does it make sense that, if this person is missing this, their body looks different or compensates in a different way. So there's lots of science behind it. We also take biology and chemistry. And those are, really important because you want to look at, things from a cellular level like you do in biology. And I know that that's something that most kids take as part of a high school curriculum, that chemistry. So think about your high school biology or chemistry class. And then, it really is quite advanced to help you understand, to be able to understand the physiology of like how the body works from a cellular level all the way up. So when we think about care, right, if you think about nursing, you're thinking about taking care of people. So, this can be in everyday life, right? So somebody comes in for like a well visit, like you do for school or for a sports physical, and it can go all the way up to, a person being so sick that they're requiring the highest level of intervention in the intensive care unit, and we're doing things for their body that their body can't do for themselves. So really it is, there's a ton of care, and it's, physical care, like, actually helping the person move and, feeding them and things like that, all the way up to emotional care, right? Sometimes, you're dealing with people who are at the best moments of their life, like when they're having a birth of a child, or, at the absolute worst moments of their life where they're losing someone that's very special to them. So you do have, a very unique opportunity to provide care in lots of different ways. And then communication. So really, nurses are the biggest part of the communication loop within the healthcare team, because honestly, we spend the most time with the patients. So, when you think about a nurse and a 12-hour shift, most nurses do 12-hour shifts. So in a 12-hour shift, at the very least, a nurse is probably in that room 12 times, once an hour. So you really get to know your patients, right? You get to know their families if they have a family member visiting with them. That is the unique thing about working with children, is that you pretty much always do have a parent present, right? There are times when there are unique situations that parents aren't present, but for the most part, we have families that are involved. So really, you are helping facilitate the communication between what's happening with the patient to the medical team so that they can make the best decision about what's going on with the patient and what kind of orders we need to do to help them get better. And then you're also facilitating the communication between the medical team and the family. So not to say a doctor isn't going to come over and talk to Johnny's mom or dad and say, this is the plan for today. But oftentimes that plan is very, it's hard to understand, right? It's very hard for parents to deal with a sick child, right? I mean, it's stressful. There's oftentimes financial burdens for people missing work, or, the child is missing school and things like that. So oftentimes the first time a family will hear a plan or what's wrong with their child, it just doesn't kind of sink in. So the nurse is consistently helping the family to understand, like, okay, this is the plan for today, and this is how this fits into the overall big plan of how we're going to make things as best as we can so that this child can be in the best condition possible when we go to send them home. Okay, so when we look at how nurses can really impact patient health and outcomes. So I was sharing with Christy and Tim, I am currently in Orlando, Florida, and Memorial sent me here. I was here for the Children's Healthcare Association conference, and really this conference was focused on quality care and outcomes. So quality care means something different to everybody, right? But to us, it means that we're providing the exact same level of care to every patient that comes through the door, and we're treating them basically with whatever, we're giving them the resources that they need to get better, and we're trying to treat everybody with asthma like the same way, so that there's no disparities related to care, because we want everybody to get quality care, because we want them to have the best outcome. So it was really exciting to me because I was able to come here with all these people from all around the United States, and we really just collaborated about what does quality care look like, and what do other places do to improve outcomes. And the nice thing about this conference is that everybody's here from children's hospitals all around the United States. So you got to meet people that are in your same role and doing the same work as you, and like learning from each other to say, how could we do this better? Or what did we miss that we could, that somebody else is doing that we could incorporate into what we're doing to make things better for our patients. So I already talked about this, about providing direct patient care. So you really are, doing the nuts and bolts of what this child needs every day. So it could be giving them a bath or giving them a shower, all the way up to breathing for them, or, doing some kind of, extraordinary intervention that's, pumping blood through their body because their heart isn't functioning. So there are so many things that we do to provide direct patient care at the bedside. And I think that this is probably one of the things that, is most evident to people when they say, why do you want to be a nurse, or what do you want to do? I mean, you're giving medicine, you're doing assessments to figure out the big plan. So the care that you're providing directly to the patient, I think, is what people who say they want to be a nurse really know that they're going to do. But I think some of these other things are things that perhaps I can expand upon so that you learn other opportunities for things within this role. So when you look at expanding access to care, so we've looked at trying to be creative, right? We know that there's disparities, right? Related to where somebody lives, or if they have a car to get to the doctor, or things like that. So we're doing creative things, like even putting healthcare centers within community centers, or in areas where it's easy for somebody to be able to walk to, so that they can still get the care that they need, even if it's not within a traditional doctor's office. So nurses really do help with this every day. We look at things like, there really isn't a place for people to get fresh fruits and vegetables within the area that this family lives. So how can we help close that gap for them? When we look at educating, this is probably, this and advocating are probably one of my favorite parts of being a nurse. But you really have the ability to look at the big picture and say, okay, this mom knows nothing about this diagnosis because her child was just diagnosed with it. So what do I need to tell her, and how can I help her understand this to help her be successful at home? Because the goal is really to do all this education, either when they're in the doctor's office or when they're in the hospital, so that they really can transition the care and continue it at home. When we look at advocating, I would say if this could be a job, this would be the job that I would absolutely want. I think that this is honestly probably something that, you learn more how to do as you have more experience. Because I think when you're new at being a nurse, you're so focused on all the tasks that you need to do for this patient, right? But this is very much big picture. This is like looking at, okay, this child is going to go home. They don't, they can't weight bear on their legs, say, because they just had the surgery. And what do we need to do to make sure that they can get in the house, and that they can get a bath or get a shower, or, and this is a very basic example, but it could be all the way up to, this person has a terminal illness. What do we need to do to make sure, everybody's on the same page that's providing care, so that this family can be successful at home with the best resources that we can give them to stay at home and be able to care for their loved one like they want to. So advocating is actually, my absolute favorite part. And like I said, if that could be a job, I would jump ship in a heartbeat and do that every single day, because that is truly what I love the most about being a nurse. All right, supporting. So you're supporting in pediatrics, you're supporting the emotional and mental well-being of your patient, right? But with every pediatric patient, hopefully comes a family. And, so oftentimes, as much as we say we have one patient in this room, right? You really oftentimes have this patient and whoever their guardian or their parents or whoever that person is for them. So, like I said, having a sick kid is very, very hard. And these are some of the hardest times that some families have ever gone through. So you really are providing emotional and, mental support to that family as well. I kind of talked a little bit about why I was here at this conference, that we're improving healthcare through preventative care. But, we try to look at when a kid is admitted to the hospital or when they're in the doctor's office, like, okay, like, are all their shots up to date? Is there anything we can educate this family on? Do we have opportunities to catch them up on things so that, we can make sure that they stay as healthy as possible and avoid coming to the hospital? Because, as much as that's our job and that's what we do, we certainly want to promote kids staying healthy at home and in their schools and with their friends and with their families, because that's how we know they all thrive. We talked a little bit about some of these, so I'm going to skip over. So when we say collaborating, so, we at Nemours are very proud of family-centered rounds. So what that means is that every day the medical team will round with the patient and their family on the floor, and they'll talk about things like, this is why they came in, this is the child's history, this is what we've done with them since they've been here, and then this is the plan for them to get them back home. So in order for that to happen, it requires a ton of collaboration. And really that collaboration happens with everybody within the medical team. So it might be collaborating with the doctor. We're a teaching hospital at Nemours, so we have doctors that are learning how to be doctors. They're called residents. So it may be collaborating with the resident. It may be collaborating with the respiratory therapist if this child is here for something respiratory in nature. So it may be collaborating with the person that's cleaning the room to say, you know what, Johnny just fell asleep and he really was up all night. So can we wait to clean his room until, he wakes up so that he can really get the rest he needs. So we really do collaborate with tons of people throughout the organization. And then last but not least is innovation. So we are really trying to drive innovation to make healthcare as good as it can be. And I'll talk about this later, but one of my biggest roles right now is I've created the virtual nursing platform for the acute care units within Nemours. And I can talk to you about that when I get to that slide, but we try to be very innovative, right? Because we want to get on board. We want to make, if there's technology that can help us make things better and alleviate, tasks that somebody else can do for us so that the nurse can spend more time with their patient, we certainly want to facilitate that so that the nurse can spend as much time with her patients at the bedside as possible. All right, so I have a little video. So every year for Nurses Week, Johnson & Johnson does a video for Nurses Week, and it's really to honor nurses. But I found this one, and it talks a little bit about the history of nursing through the decades. So I'm going to play this for you, and then we'll talk about some of the people who are in this.
During the Crimean War, more soldiers died from infection than in battle. Until a nurse introduced sanitary practices still in use today. When the scourge of polio hit the world, it was standard practice to strap down and immobilize patients. Until a nurse discovered that movement and physical therapy had far better results. In the 1950s, jaundice was a leading cause of infant death, until a nurse found that a few hours of sunlight could actually cure the condition. At the dawn of the AIDS epidemic, no one knew how the disease spread. So patients were kept quarantined and alone, until nurses defied convention and embraced them with compassion. During the Ebola outbreak, the disease was thought by many to be too contagious to treat, until a student nurse used what she had on hand, garbage bags and duct tape, to protect herself so she could care for others. And cerebral palsy robbed many patients of their ability to speak, until a nurse gave them back their voices. And I will always be grateful to her.
All right. So you saw a little bit about Florence Nightingale in this movie or in this video that I just showed. But really, when you think about nursing in general, most people will say Florence Nightingale. We'll have, we have a couple of bulletin boards like throughout the organization, like what would Florence say or what would Florence do? So it's really something that even still today is very much, a part of our culture and of nursing. Clara Barton was another one. She was an Army nurse during the Civil War, and she helped make makeshift hospitals to care for the soldiers that were injured. So she's another one that a lot of times when people think about nursing, they'll talk about her. All right, so we kind of talked a little bit about this earlier, but as a nurse, you do have the ability to improve patient outcomes. You do have the ability to advocate for families and or patients for what you think they need or what they're telling you they need. And, one of my favorite things is to be able to help someone through the best and the most challenging times of their life. When you think about qualities of someone who really is a good nurse, you have to have a lot of compassion, right? No matter what's going on in your life, you have to kind of leave it at the door because these people need you and they need the best version of you. So, a lot of times, you're giving more than you have to give, right? But you just do it. And when you have to give more, you somehow find a way to give more. You have to be really empathetic, right? You don't have to say, I know how you feel, but you have to say in that moment, like, you know what? I don't know how you're feeling. And that's okay to say that. But you know what? I'm here with you today and I'm going to be as supportive as I can so that, you get what you need or that your son or daughter gets what they need. You really do have to have impeccable communication skills. You're communicating with so many different people, families, doctors, other nurses, charge nurses, nursing supervisors, to really get these children the care that they need. You always have to be a great problem solver because it's not about what's the problem. It's you're constantly figuring out like, well, what's the solution, right? If you call the doctor and say, hey, Johnny's heart rate's really high. You've got to think about why is Johnny's heart rate really high based on why he's here. And if he's here for dehydration, you're probably thinking, oh, he needs some more fluid. That's why his heart rate's high. So it's thinking about the big picture, but then also coming up with what could the reasonable solution be. All right, so we're going to talk numbers here. So there's 4.3 million nurses in the United States as of 2023. So it does make up, the profession of nursing does make up the largest portion of the healthcare system. So when we looked at projected growth from 2023 to 2033, this profession is expected to grow by 6%, which is really faster than any other occupation. But you know what? We need it because we need almost 200,000 nurses every year to be able to keep up with people retiring and, as baby boomers get older, we need to be able to take care of them. And it takes nurses to do that. So when we look at demographics have really changed. So when you looked at nursing, even back when I became a nurse, it was actually pretty rare to have a male nurse. I did have 2 male nurses in my class of 40, but when I graduated, I primarily worked with women when I was a new grad. But the workforce is really changing. So it's becoming more racially and ethnically diverse. There are definitely more men. So about 12% of our workforce now is made up of men. And the workforce is actually much, much younger. So when you look at, people in a hospital or people at the doctor's office, you do have much more of a chance of having a new grad take care of you, or somebody with, less than 5 years of experience, because those are really the people who want to be in that environment and who really want to work, with that population of people. Kind of already talked about that. I said we need 200,000 nurses every year to meet the minimum. So if you look at what nurses do, this is going to be different no matter based on where you work. However, when you think about things that nurses do, you're thinking about doing assessments. So pulling out your stethoscope, you're listening to lung sounds and heart sounds, and, checking capillary refill, which is when you push on your finger and, see how quickly it rebounds. So we're doing things like that all the time. And I think that those are the things that, are most prevalent to people, that, they know that nurses give medications and do assessments. We already talked about providing the emotional support to patients and families. We do a lot of teaching on how can you make your life better, and how can you improve your health so that you can stay as healthy as you can. We're going over like treatment plans that doctors and nurses have worked together to make, so that we can get you home, or we can keep you home, and make you as successful as possible and the healthiest that you can be. We're also like doing lab work. So you might draw blood and then wait for the test to come back from the lab. You might have somebody that had a surgery and needs a dressing changed, like a big bandage across their belly or their leg. So we do lots of that. But lots of things that are very much geared to care at the bedside. So when you look at registered nurses in general, there's tons of different types, as you can see here. So if you look at nurses in a hospital, that's an acute care setting, right? We're providing acute care to them, as opposed to somebody who might live in a nursing home, which is considered chronic care or geriatric care if they're part of the elderly population. Some other ones to highlight: oncology nursing is the care of patients with cancer, and that could be pediatric or adult in nature. Rehab is helping someone get back to their maximum abilities, after an accident or after a surgery or something like that. Psychiatric nursing is something that has changed a lot over the years. So, when I became a nurse, we had psychiatric places that we sent people who needed mental health treatment. Now, really, psychiatric nursing is woven into every aspect of every type of nursing, because we know, especially after the pandemic, that there's lots of people suffering with anxiety or depression. And really, it doesn't matter if we have an asthma patient who's there with asthma who has it, or the geriatric patient who's in a nursing home and suffers from depression. So really, psychiatric nursing is more prevalent now in all aspects of nursing, really through time, and really specifically post-pandemic. Perinatal nursing is before the birth of a baby. Family nursing, looks at the care continuum for a family. So having a child and then having, a grandmother that you're taking care of or something like that. So we look at that throughout the stages. The ones that are newer are really these ones at the bottom. So telehealth became very prevalent during the pandemic. It was the ability to, use Zoom or Teams or something like that to have, a meeting with your doctor, because we were all trying to, quarantine in place to prevent the spread of COVID. And really that the ability to continue those appointments has really stuck, because we learned how efficient we were when we could do those kind of things. And then virtual nursing is the program that I am in charge of in the Delaware Valley at Nemours. And that really looks at, how can a nurse that's removed from the bedside use technology and really provide support to the nurse at the bedside to provide better care to that patient. So it's a ton of admission and discharge stuff. So, what meds are you on at home? What pharmacy are you going to use for discharge? Like things like that. And then, maybe you have somebody who's a new diabetic and needs a ton of teaching. That nurse can do all of the teaching related to that disease process that doesn't require someone to provide hands-on, at the bedside support, and do that all. We do it all on a TV screen. It looks like a FaceTime call. And you have the virtual nurse in the center and the family at the top. And, she's providing dialogue back and forth on the TV screen in the room to do this. We also have virtual models of care, like to take care of families at home. And they do this in, we haven't done it yet in the pediatric setting in Delaware, but there are models of care like that for adults as well. So really, we're trying to use the technology that we really kind of pushed during the pandemic and say, how can we make this better to provide the best care possible to our patients? There are administrative roles like the role that I am in. A nurse educator is really somebody who's an expert in that area, who does provide support to the nurse at the bedside for education, or, I've never done this before. Well, we're going to go in together and I'm going to do it with you the first time so you're comfortable. Case managers really work with insurance companies and, set up a lot of services for people at home. Nurse informaticists really look at our medical record, right? Everything's documented on the computer now. So how can we streamline things to make this as easy as possible for the nurse who's caring for the patient? And then chief nursing officers and directors of nursing are the people that work above like my level to do administrative things, for the hospital. So if you're thinking, oh, this might be for me, so some classes to consider in high school would definitely be like bio and chemistry. And I think for most high schools, that's pretty standard, but really pay attention in those classes. See if it's something that really interests you, because, it is really something that will really help you understand the physiology of, how the body works and, and from a cellular level, why things happen the way they do. Any kind of health sciences. And then anatomy is actually a great one to take at the high school level so that you can kind of get it under your belt. Anatomy is a very, very hard class, I think. It's a ton of memorization, but if you can take it at the high school level, I think it makes it so much easier at the college level. All right, so we kind of talked about this already. ADN program is like something like Deltec, which is with prerequisites, it's probably more like 3 years. And then a 4-year degree is a bachelor's. If you want to do an ADN program, it's about 2 to 3 years. A bachelor's is about 4 years because it's a full 120 credits. And then you do have the option to do like what I did. Now, I will tell you, I waited way too late in my life to do my master's like I did. I should have done them a long time ago. But I had kids and I had conflicting priorities and, everything like that. So I didn't do mine until I was like 43. And it took me 3 years to do it because I worked full time and I was managing this unit and I was taking classes at the same time. But, there are lots of ways to do your advanced degrees now. If you're not going into something clinical, mine wasn't considered a clinical master's. So I was able to do it online. I wrote papers at soccer tournaments in the parking lot. I gave my final presentation in the fire lane of my daughter's high school because I wasn't willing to miss anything for my kids to be able to do this for myself. So there are lots of ways that you can continue your degree while you're working and, still be able to have, a normal family life and do all those kinds of things that most of us that are moms don't want to give up. We already kind of talked about the NCLEX. I told you everybody takes the same test. The test really looks at, are you competent in basic care, prevention of disease, coping and adaptation, and pharmacological therapies? So really, it really just looks at, are you prepared to be a new grad and have a ton of support for wherever you start and be safe providing clinical care? And really, once you pass that test, unless you don't practice or let your license lapse, you don't ever have to take that test again. Most of us will say, thank goodness for that, because none of us want to do that again. But then you just follow the licensing requirements in your state. So Delaware has a board of nursing. You follow the requirements for the Delaware Board of Nursing to maintain your licensure within the state of Delaware. These are some places that nurses work. So hospitals, medical offices, nursing homes. I don't know if any of you where you go to school have, home health or health clinics in your high school or middle school. A lot of the Delaware schools are, having them. Some of them are partnerships with Nemours. It's not uncommon for there to be some in churches and schools. And I think that this is really the reach, right? We want to meet people where they are and give them the support they need where they get it. And it may not be in a traditional setting like a hospital or a doctor's office like it used to be, but how can we be creative and get them the care that they need somewhere? All right, so this is probably what everybody wants to know. So how much money will I make? So if you look at the average nursing salary in the United States, both of these numbers are for a new grad. So a new grad, so somebody that's right out of school with no experience, will make about $73,000 a year. And the new grad rate, it's an hourly rate at Nemours, is $42 an hour. So that gives you a little bit of insight on how much you will make right out of school. And then there's opportunities to be certified. So I am certified in pediatric nursing. There are tons of certifications for people who specialize, right? So there's a school nurse certification, there's a certified pediatric nurse, there's a critical care certification, there's a cancer certification. So really you look at once you've worked and completed the hourly requirement to be an expert in that area, you're eligible to sit for an extra exam and show that you are competent in that area. And then you can say, I'm a certified pediatric nurse, and that's because I passed the CPN exam. So, I don't want to act like this is all, all pretty and roses. There are some challenges in nursing. Some of it is work-life balance. I already said to you how you can be creative with shifts and things like that. But, we do provide 24/7 care, 365 days a year. So with that comes, there are people working night shift. There are, every nurse that works in the hospital works weekends. You do work holidays, which are all, important things for us. So, there is some give and take, and, it is hard. The days they are long days, right? 12 hours is a long time. It's very demanding. There's not much downtime when you're there, so it can be very high stress. And, you're dealing with a lot of people dealing with the most emotional times of their life. So, when you're constantly helping other people through emotional challenges, it does bring emotional challenges to you too. And sometimes you're just, it feels very heavy, and you have to really build in lots of strategies early on to figure out how you balance that, how you leave work at work when you leave, so that you can change gears and focus on your own family and your own well-being when you go home. All right, so I have a little video to show you real quick about Nemours.
I think pediatric nursing is really something special and something that a lot of nurses should really take the opportunity to take on, especially on 2 West, because our patient population is so diverse and you can learn so much, and they really give you the opportunity to advance your nursing skills and your nursing education.
I chose Nemours because when I walked in, it felt more like a family and a community hospital.
Our crew on 2 West is so supportive and so helpful on every shift. I always have someone there to guide me in any sort of way.
I think my best memories and my happiest times at Nemours are when we do parades for patients that have been on our floor for a very long time.
Our main goal is to make sure that our patients are safe, or make sure our patients are cared for. So we all have the same goal. And usually when you have the same goal, everyone has the same happiness, joy, respect for one another, because we all see the same goal at the end of the day, is just to make sure that our patients are protected, cared for, safe, and we can get them back home. Working with children is an experience. You're working with the children, you're working with the family. It's a holistic thing. We're focusing on the whole person. It's very enlightening, it warms my heart. And sometimes people don't remember who you are, but they can remember how you made them feel. And that's what I strive for every day.
All right, So I would really encourage you, if this presentation was, you felt like, it kind of hit you in a special way, I would really encourage you to, look online. You can visit local hospitals. I would encourage you to talk to people that are nurses and say, what do you love about your job? What do you wish you could do differently? You can shadow a nurse if you want to shadow a nurse. There are opportunities for that. And really look in the community. There are volunteer programs. Nemours does have one for high school students where you can volunteer. It's a summer program. You can come in and, they put you throughout the hospital and you really help the people that are providing care to children every day. And at the same time, you're getting exposure to say, do I think this is a good fit for me? Do I love what this feels like? Do I like what this looks like? And can I see myself doing this maybe moving forward? So Margaret LaFascia is, the connection for any kind of shadow experiences, but she'll really connect with you if you're interested and help you find the best fit within Nemours, to see if you think nursing might be for you. And I think that is it for me. That's all I have.
Great, thanks, Julie.
Alrighty. Okay, all right. Does anyone have any questions for Julie? Julie, I think one of the things that you did is right at the end, you addressed some of the things like, how much money do you make? And it's stressful. You put that right out there. So bravo for you for being forthcoming. That's often.
I've done this presentation a few times at like a high school. And I feel like that's what the kids always want to know. How much money am I going to make?
Right. So Beatrice asks, what age is required to volunteer at Nemours? I guess we're going to ask here.
So I'm pretty sure in the high school program, you just have to finish your freshman year of high school. So I will say that on the Nemours website, there is volunteer information. You can click the volunteer tab and it does give you information about the summer program. Unless they change it, the summer program, typically applications are accepted in the month of February for that program. It's very competitive. It does require like high school, like counselors to submit letters of recommendation for you, but it is, I have volunteers on my unit every summer. I do take a lot just because I believe in this. And, I think that this is how, you see what nurses and doctors do every day. So, I think it's easy to say, like, I know what my pediatrician does when I go there. I remember what happened when I went to the emergency room, but, I think it's much more rewarding when it's not you, right? Like nobody wants to have their own experience. They would like to see it in action when they're feeling well and at their best.
Right. I see that Robin Morgan has her hand up. Robin, please put your question into the Q&A. We don't do raised hand. Okay, are there any diploma associate programs for folks with no nursing background that are interested in virtual nursing, telehealth nursing?
So virtual nursing isn't something that requires any kind of different degree. There probably are diploma programs throughout the United States somewhere. BB School of Nursing used to be the diploma program within the state of Delaware. They've now partnered with the University of Delaware, and that's a 4-year program. So I'm not aware of any within like our general area. The associates program is pretty popular. If you look at our tri-state area, Deltec is definitely one. Cecil Community College has an ADN program. Delaware County Community College, right over the Pennsylvania line, they have an ADN program. So there are ADN programs, but I'm not aware of any diploma programs that are within our, general area of the state of Delaware.
Right. So Julie, I've got a question for you. So you have gotten certifications, but you've stuck at you're happy at the RN level. I understand that there are other things, other pathways you could go depending on whether you might go into administration or research or advanced clinical care. Can you talk about what would be next for you if you wanted to go further up the ladder?
Yeah, you're going to push me in that direction, aren't you? So when I got my job as a nurse manager, I got that job in December of 2019, and the shutdown for the pandemic happened in like February, March of 2020. So I was brand new at my role when this happened. And I thought, oh my gosh, like, how am I going to do this? And I have to keep up with school because I told them I was going to get my master's, but I did it. I mean, it was all online and I did it. So my master's is, it's a nurse executive master's. I went to Wilmington University. They have several programs. So really the master's level programs are nurse executive. You can get your master's in healthcare administration. You can also get a nurse practitioner. So a nurse practitioner can work like in an office. We also have nurse practitioners that can work in a hospital. And then you can also get your master's in education, which would be like a clinical nurse specialist or a clinical nurse educator. So if I want to go back to school right now, it would be for my doctorate. I've actually thrown around like whether or not I might go back for my MBA. Lots of nurses do an MBA with a master's, which is a master's in business administration. And if you're in the role that I'm in, you do a lot of financial stuff, and you're doing like FTE reports to figure out how much staff you need based on patient volume. That's all mathematical. Like it's a formula, right? We're figuring it out. But I could do that, and that would help me a lot. I could also get my doctorate in nursing, which I'm not sure I'm ready to go back quite yet, but maybe in a couple of years.
Yeah, I got my master's in public health at the ripe old age of 50. So you've got lots of
I
time.
still have time.
Yeah, you've got lots of time. Yeah, and so sorry, didn't mean to hit a sensitive nerve, but it is always
all good.
interesting why some people, are real happy sort of being at a level, and other people just keep going.
I think I've always been of the mindset, like when I know like how I could professionally like advance myself by doing that, or I see like, oh, if I did that, because as you like get more degrees, for lack of a better term, you really are, you're narrowing your focus, right? So, a nurse that has a diploma or an associate's or a bachelor's, right? You're providing like a wide range of care at the bedside, right? As you start to specialize, like the more specialized you get, the more degrees you get. So, probably at some point I'll go there, but not yet.
Right. And then, so Morgan asks the ultimate follow-up question. So how long do you recommend waiting to be a nurse practitioner after being a new grad RN?
So my personal take on this is I think, and this is not what they do, but I think you should have to be a nurse at the bedside for like 5 years, because you need to like see things. You need to see sick kids. You need to see, what does this look like, right? You don't come out of nursing school having all the answers or all the experience. Like nursing is very much, you learn as you do it. So whenever I hear people say, oh, it's been a year, I'm going back, I'm like, oh, just give yourself a little time and give yourself, because you do truly, you learn from experience.
Yeah. Well, and I think the other thing I would say to all the students is that each one of these additional, in particular, the degrees, is a major commitment of time. It's a major commitment of money. It is going to be an additional, probably, level of stress in an already, work-life balance, and keeping all that, in tune. It can be a lot, especially if you're raising a family and working full time.
It is a lot. The one thing I will say though, Sorry, it's getting dark where I am, and I just thought maybe if I turned on that light, but it's not in a good spot. The one thing I will say is, most hospital organizations do tuition reimbursement. So I can tell you, like I started at Nemours with my associates. Nemours paid for me to go back and finish my bachelor's, and Nemours paid for my entire master's. So other than my first degree, I paid for none of my education.
Hey, let's see. Do you recommend being a CNA before going into nursing? Someone was thinking.
Do I recommend that? Is that what you said?
Yeah.
Yeah, so I think a lot of associate programs currently are making people get their CNA before they accept them into the program. I think any exposure you get to healthcare will help you. Certainly being a certified nursing assistant, you learn how to do vital signs. And more importantly, you learn how to interact with people. I think, it's hard. Like you just learn how to figure out the dynamics of people. I think it teaches you time management, which is huge. To have, these are my patients, this is what I have to do for them, and this is the amount of time I need to do it in. So I would recommend that if you're interested in, because it gives you more exposure, and then you can see, what's out there. You can work alongside nurses. And I mean, I always said when I was at the bedside, I would always say to students, like, if I was doing something cool, like, oh, come in with me, like, you want to see this, like, because that's how you learn, and that's how you get exposure to, what nurses do.
Right. Okay. Well, Julie, thank you so much for presenting from Orlando, Florida. Go out and have a lovely evening before you travel back to significantly cooler Delaware. We're holding on to the cool weather. So I want to take a moment just to answer a couple of questions that have been in the chat overall. There is no makeup session next week. That was only going to be if we had a technical problem or if the class had to be canceled due to one or more of the presenters having a clinical obligation. So there is no makeup session. And the other thing is, a couple of people have said, oh, there was something wrong with my connection tonight. And, while I be candid here, just email nsabine@delamed.org, and that'll be that. The next mini medical school series starts on the 16th. You all should have gotten an email. This next one is with Christiana Care, and it will be covering a wide variety of topics rather than being focused just on children's health and pediatrics. And I want to extend to Julie and to all of the other presenters from Nemours Children's Health our sincere thanks for being willing to join us. And until next time, see y'all later. Good night.